All right, we are doing our newborn assessment. So for this, we are going to maintain patient privacy, safety, and dignity. We will be using an age-appropriate approach in communication. We will introduce ourselves to patient and parents. We will have looked at the chart for the birthing history to find out if baby was born vaginally or C-section, if any trauma occurred, and or special interventions were used during birth process. Vital signs would have been taken, temperature, pulse, respirations. Baby would have had pulse taken apically for 1 full minute, also listening for any heart murmurs. Height, weight, head circumference and chest circumference will be taken. Head at the brow line, chest at the nipple line. We'll be observing baby for overall general appearance, that baby is not laboring and or in any respiratory distress, bleeding and or hemorrhaging, bleeding from the umbilicus. That baby is symmetrical, 2 arms, 2 legs, 5 fingers on each hand, 5 toes on each foot. We'll also be checking the skin all over for vernix, lanugo, erythema toxicum, petechiae, milia, and Mongolian spots. Baby's head will be assessed, the anterior and posterior fontanelle. The anterior is a diamond shape, the posterior is a triangular shape. We're making sure they are not bulging or sunken in. We are looking for cephalohematoma. We are looking for caput. We are also looking for molding, which can happen during the birthing process. Making sure the ears are well formed and intact, line up to the outer line of the eye. We're checking the eyes, assessing color. They're usually, iris is a slate gray in color upon birth. We're checking the conjunctiva to make sure they're clear. We're assessing for pearla. Babies will not have accommodation at this point though. Also, strabismus could be a normal finding at birth as babies' eye muscles are not well developed. We're checking the nose. Nostrils are present bilaterally and patent. We are checking the mouth, making sure that the palate is present and intact. We're checking for Epstein curls, which are our normal finding. We're assessing the nipples for size and engorgement and if there's an extra nipple. We are assessing the abdomen for distension. We are auscultating for bowel sounds that should be present shortly after birth, as well as meconium by looking in their diaper. Babies should void within 24 hours after birth. Baby girls, we are checking that the labia is covering the clitoris. They also can have some discharge and or pseudomenstruation. That's a normal finding. Baby boys, we are checking the penis for the urinary meatus, which should be at the tip of the penis, that their scrotum, the testicles have descended from the abdomen and there's rugae present. We are checking baby's hips for any dislocation, displacement, and or clicks or crepitus, that there's range of motion. Also the arms, any crepitus, and that we have range of motion. Checking the feet for plantar creases. We are checking that there are gluteal folds present bilaterally and even. We're checking the vertebral columns present in alignment with no holes, that the anus is present and patent. We are again assessing for voiding pattern, urinary and bowel elimination by looking in the diaper. Baby's reflexes, we have the Moro reflex, which is holding baby about 30 degrees up and dropping them slightly. They should have a startle reflex from that We are checking the rooting reflex by rubbing the side of their face, and they'll turn towards whichever side you're rubbing. The sucking swallowing reflex by stimulating that palate with the pinky and or observing them bottle feeding or breastfeeding. Baby also, we will assess for the tonic reflex, which is their arm and leg will be facing the same direction as their face with the opposite side flexed. Checking baby's muscle tone. They are flexed and not floppy. We are checking the palmar reflex by rubbing underneath their fingers with their thumb, and they'll curl over, grab you, and the same with the plantar. We'll rub under their toes and their toes will curl over. We will check the Babinski reflex by rubbing from the heel up around to the ball of the foot, and their toes should fan out. We will check the stepping reflex by holding them up with their feet on a firm surface, flat surface, and they will raise one leg and then the other, mimicking walking. We'll check the incurvation reflex by rubbing one side of their spine, and they will curve to whichever side you are checking. We will check baby's activity. They can be quietly alert, actively alert, in a light sleep, a deep sleep, or crying. So that would be our baby assessment. Again, maintaining patient safety, privacy, and dignity.